Well, good morning. Welcome to The Agent's Advisor, theagentsadvisor.com. I want to welcome you today to our weekly webinar. My name is Joe Morris. I'm the CEO of The Agent's Advisor, theagentsadvisor.com. I want to welcome you to today's webinar. We're going to get started. Today's webinar topic is Medicare Calculating Part D Penalty. Today's webinar is being brought to you by Advisor TV, Advisor Radio, also brought to you by MedPlan Network, your medical insurance partner, Benefits Resource Systems, the broker and employer source for employee benefits, and Benetrust, self-funding and TPA brokers. I'm your host, Joe Morris, CEO of the Agent's Advisor and MedPlan Network. I'm very pleased to be with you today on Advisor TV, Advisor Radio. Our purpose is to empower the independent insurance agent and to educate agents, advisors, consumers, and businesses on their insurance and financial planning product and service options. Today's webinar, Medicare Calculating Part D Penalty, we're going to discuss who's affected, when does the Medicare beneficiary find out what their penalty is, how is the penalty calculated, how much is the penalty, what does an advisor have to do, and what's the next step for an agent or financial advisor. Today's webinar is being brought to you part of a series going over various subjects and topics that deal with Medicare. And watch your email. If you miss a broadcast on Advisor TV, Advisor Radio, or a webinar, you can always catch the on-demand replay by subscribing to our YouTube channel. Go to YouTube, hit the subscribe button, and you can get the latest updates by hitting the little bell. Click on that. That will give you the updates as we bring more broadcasts to you. As a subscriber, the benefit is you'll be able to get the latest updates on what we're doing, whether it be breaking news, whether it be training modules, or a special guest interview that offers a product or service that can dramatically impact the way you do business. So let's go ahead and get started on today's webinar. So what is the Medicare Part D penalty? The Medicare Part D penalty is the late enrollment penalty, and it's an amount added to your Medicare Part D monthly premium. What that means is if you enroll late into your Medicare Part D, there's a penalty counted, and it is in addition to whatever the standard premium would be on your Part D drug plan. Who is affected? Well, you may owe, or your client may owe, a late enrollment penalty if, for any continuous period of 63 days or more after your initial enrollment period is over, you go without one of these. If you go without a Medicare prescription drug plan, a Part D, if you went without a Medicare Advantage Part C, like an HMO or PPO plan, or another Medicare health plan that offers Medicare prescription drug coverage, or if you went without credible prescription drug coverage. Now, I want to note that those that are dual eligible or receive extra help, they're exempt of the penalty. So what that means is if they're eligible for Medicaid and Medicare, if they're low income subsidy or they're getting extra help towards their health care expenses such as insurance premiums, they are exempt of the Part D penalty. When does the beneficiary find out what their penalty is? You're going to find out when you enroll in a Medicare Part D plan. The provider will tell you if you owe a penalty and what your total premium will be. The provider meaning the plan. If you go in and enroll in a Part D drug plan, for example, or a Medicare Advantage plan, for example, they're going to let you know, based upon your last enrollment, if you are going to have a penalty or not. So how do you know if you owe the penalty? Well, after you join a Medicare drug plan, the plan will tell you if you owe the penalty. So as I said, you'll know what your penalty will be and what your premium will be. In general, you'll have to pay this penalty for as long as you have a Medicare drug plan. So how much is the penalty? Well, the cost of the late enrollment penalty depends on how long you went without a Part D or credible prescription drug coverage. There's a national base beneficiary premium, and it increases or could increase every year. It's a base premium, And so your penalty amount will also increase each year as the national base beneficiary premium amount changes from year to year. So let's take a look at what that looks like. So how is the penalty calculated? Well, Medicare calculates the penalty by multiplying 1% of the national base beneficiary premium. So in 2018, the national base beneficiary premium is $35.02, $35.02. So that number, $35.02, and the 1% of that times the number of full uncovered months you didn't have a Part D or credible coverage. The monthly premium is rounded to the nearest 10 cents or tenth and added to your monthly Part D premium. Now, as I said, the national base beneficiary premium for Part D may increase each year, so your penalty amount may also increase each year. So let's take a look at an example of what that means and how that would be calculated. Let's say Mrs. Martinez is currently eligible for Medicare, and her initial enrollment period ended on May 31st, 2014. She doesn't have a prescription drug coverage plan from any other source. She didn't join by May 31st, 2014, and instead joined during the open enrollment period that ended December 7th, 2016. That open enrollment period, as we call it, the annual election period, AEP, so that's when she decided to do it. So in essence, how it works, as you know, during the open enrollment period every year, October 15th through December 7th, her drug coverage date, effective date, would be January 1 of 2017. So since Mrs. Martinez went without credible prescription coverage from June 2014 to December 2016, her penalty in 2017 was 31%. That's 1% for each of the 31 months of $35.63. That's the national base beneficiary premium for 2017. So the 31%, meaning 1% for every month she went without coverage, times the $35.63 would be $11.05. Since the monthly penalty is always rounded to the nearest tenth, she would pay $11.10 each month in addition to her plan's monthly premium. So here's the math. 31 cents, which is 31% penalty, 1 times the number of months, times $35.63, which was the 2017 base beneficiary premium, that equals $11.05. When you round to the nearest 10th cent, the 10th, it would be $11.10. So Mrs. Martinez, monthly late enrollment penalty for 2017 would be $11.10. So in 2018, Medicare recalculated Mrs. Martinez's penalty using the 2018 base beneficiary premium of $35.02. Now, did you notice it went down? In 2017, it was $35.63. In 2018, the national base beneficiary premium is $35.02. So Mrs. Martinez's new monthly penalty in 2018 is 31% of $35.02, which is, again, the national base beneficiary premium amount, which equates to $10.86 each month. And since the monthly penalty is always rounded to the nearest tenth, she will now pay $10.90 each month in addition to her plain monthly premium. So here's the math. 31 months, remember, 1%, so it's a 31% penalty times the 2018 base beneficiary premium would equal $10.86. When you round it up to the nearest tenth, or 10th cent, it's $10.90. So for 2018, Mrs. Martinez's late penalty enrollment penalty would be $10.90. So what if Mrs. Martinez or your client or you would disagree with the late enrollment penalty? Well, you may also ask for reconsideration. Your drug plan will send you information on how to request a reconsideration. A reconsideration is a form you would complete the required reconsideration form, and return it to the address or fax number listed on the form. You must do this within 60 days from the date on the letter telling you that you owe a late penalty. You also send any proof that supports your case, like a copy of your notice of credible coverage from an employer or union plan, or maybe you had a plan elsewhere and it was credible. When you complete the reconsideration form, you always want to make sure you put all the appropriate and necessary documentation to support your request for reconsideration. Do I have to pay the penalty even if I don't agree with it? By law, the late enrollment penalty is part of the premium, so you must pay the penalty with the premium. You must also pay the penalty even if you ask for reconsideration. Medicare drug plans can disenroll members who don't pay their premium, so always pay them, including the late penalty portion of the premium. Otherwise, you can be automatically disenrolled. In layman's terms, if you let it lapse, you'll be without coverage, and consequently, if you lose that reconsideration request appeal, you would have to wait until the next open enrollment period of the subsequent year to get back enrolled into a Part D drug plan, which would also increase the number of months you've gone without coverage, which would increase the amount of penalty you would pay, so it wouldn't be good. So the answer is, yes, you have to pay the penalty whether you agree with it or not until your reconsideration request and appeal has been approved. How soon will I get a reconsideration decision? Well, in general, Medicare's contractor makes reconsideration decisions within 90 days. So the contractor will try to make a decision as quickly as possible. However, you may request an extension, or for good cause, Medicare's contractor may take an additional 14 days to resolve your case. So you can really push that. And what Medicare is telling us here, their contractor, they use a third-party vendor to manage the prescription penalty, the Part D penalty. So when they say contractor, Medicare's office has a third party that actually manages this. That's where you would send your reconsideration form to, along with your documentation to support your appeal. And it can take up to 90 days. However, you may request an extension to get all the facts in place, which would be possibly an additional 14 days to resolve your case. So what happens if the Medicare contractor that we just discussed decides the penalty is wrong? If Medicare's contractor decides that all or part of your late enrollment penalty is wrong, the Medicare contractor will send you and your drug plan a letter explaining its decision. Your Medicare drug plan will remove or reduce your late enrollment penalty, and the plan will send you a letter that shows the correct premium amount and explains whether you get a refund. So there's a possibility if your reconsideration appeal is approved, you could be receiving a refund and or a reduced penalty amount, which would subsequently reduce the amount you pay each month. So what happens if the Medicare contractor decides the penalty is correct? If the Medicare's contractor decides that your late enrollment penalty is correct, the Medicare contractor will send you a letter explaining the decision, and you must pay the penalty. And you will continue on as you have been on that. So either way, the key is if you feel like you need a reconsideration approved, then file the required form, the reconsideration form, attach the appropriate documentation to it, and wait for the response from the third-party contractor that decides the penalties, whether they're valid or invalid. And hopefully you'll find it in your client's case or your case that it was invalid, and you'll be receiving a refund and a premium adjustment in terms of the penalty. But the premium will not change based upon the plan. The key on this is we're calculating Part D penalty, and if there's a penalty calculation error, then you would be seeing the offset in form of a refund possibly and an adjustment to your actual monthly premium. So hopefully that helps you kind of get an idea of what that is in terms of 1%, the national premium-based premium, and how to calculate it by the number of months and so forth. So what's the next step for an agent or a financial advisor? We want you to visit these websites. They're great reference tools. Take a look at theagentsadvisor.com. There you'll see the link under our resources tab. There's some great links for good information in terms of the who's who and what we do. Also go to Medicare.gov There's under Medicare.gov in their search, if you put in Part D late enrollment penalty, there's a great explanation of that. I also like using Q1Medicare.com. That's a great tool, a great site for you to bookmark all things Medicare, particularly Part Ds. You can find the best plans by market. You can calculate premiums by prescription drugs, but you can also look at the plan availability by zip code in your state. If you want to use a true calculator, which I really like using, I like iMedicare.com. iMedicare.com, they have a penalty calculator that you simply put in the number of months, dates, and it calculates what your premium will be for you. I encourage you to reach out to us and call us. We'll give you an update, and I can send you the links. You'll also get a copy of this, so you'll have the links there. Check your email. Watch for it as we do our weekly follow-up to our webinars. And I want you to stay tuned on future webinars, because if you're interested in learning more about Medicare, I encourage you to attend our next webinar. The subject's going to be Medicare Calculating Part B Penalty. It's going to be Tuesday, June 5th at our normal times, 10 a.m. and 2 p.m. Eastern Standard Time. If you have any questions, call the Agent's Advisor at 877-886-4829. You can always email the Agent's Advisor. Email us at info@theagentsadvisor.com. Lastly, you should work with the Agent's Advisor. We'll discuss this with you and how we can help you grow your business. We'll send you more information about our products and services. We'll help you in migrating your existing carrier contracts. It's seamless. It's easy. We'll guide you through that. We want you to subscribe to Advisor TV at our YouTube channel. Like us on Facebook. Connect with us on LinkedIn. All of our social media platforms are all linked, vertically linked into our program. We highly encourage you to take a look at that. We upload weekly good content, good information in terms of how we can dramatically impact the way you do business and help you grow, not only from a agency standpoint, but help you with lead generation, help you with products and services, help you with marketing and social media build-outs, and we can also help you with growing and driving revenue. If you're interested in growing your agency in terms of being an agency builder and recruiting new producers, we'd love the opportunity to talk to you about that. We've got a number of programs and how-tos on what you can do to do that in your particular market. We're always looking to grow our footprint around the nation. Currently, we're doing business in about 10 states. We're growing every week in that area as well. And for those of you that know me, we've done business with it over the number of years that we have. Always open and interested in helping you and looking at new ideas and new concepts. But again, mark your calendar on Tuesdays at 10 and 2 Eastern Standard Time, 10 a.m., 2 p.m. We do a weekly broadcast and a webinar that's going to help you and help you navigate this market. Also, check out Advisor TV. Each week we have a week in review segment, and we also will do a special guest interview that will dramatically impact how you do business, whether it be in the health markets, the Medicare markets, the life markets, the annuity markets, the group benefits, and the business-to-business markets. We also will throw in recruiting tips, training tips, and how you can really be a true agency builder. So we want to thank you for visiting with us today. If you're looking to grow your insurance business, call us at 877-886-4829. You can email us at info@theagentsadvisor.com or visit us on the web at theagentsadvisor.com. As always, thank you for your business. We appreciate the trust and confidence you put in us and you've given us. We don't take it for granted. We're very grateful for it. And we want you to make it a great day.